Assalamu alaikum, ma'am. I am roll number 198, Usama Naeem here. So we are going to present our research topic from batch 8, sorry. So the topic of our research is impact of irritable bowel syndrome on health-related quality of life in Southeast Asia, a systematic review. So I would like to ask Isha Sarfraz to please present the abstract.
Assalamu alaikum. My name is Isha Sarfraz, roll number 44, and I'm going to present the abstract of our research article. Background. Basically, IBS is a chronic functional GIT disorder with altered bowel habits. Studies show that IBS constitutes a tremendous global burden on health as its global prevalence is 11.5%, 10 to 15%, and most people have a relapsing course. We conducted this systematic review to compare and contrast the symptoms and the quality of life experienced by patients with IBS in Southeast Asia. Articles comparing different populations and age groups on these topics are scarce, so we aim to fill that gap with this review method. We performed this systematic review in compliance with the guidelines of PRISMA, PubMed, Google Scholar, and ParkMedinet, which are searched to retrieve studies published from each database inception to 22nd of October 2022. No language restrictions were put forth to reviewers. UNA performed the database search using combination of keywords. All the relevant articles were transferred to Zotero and screened in order to remove duplicates. Results. We included 9 studies in our systematic review after a comprehensive research through various databases, which met our inclusion criteria and studied the repercussions of IBS and the influence of IBS on patients' quality of life in Southeast Asia. Our data proposed that IBS constitutes a tremendous burden on the healthcare system of Southeast Asia and has deleterious effects on the health-related quality of life of patients in Southeast Asia. Our systematic review showed that IBS was significantly associated with diminished quality of life. Studies showed that there is a strong association between psychosocial symptoms, generalized symptoms of menstrual pain, bloating, belching, and vomiting. Stress was established as a correlative of IBS, while a study also discovered the association of employment with IBS and found IBS to be significantly higher among employed personnel. These symptoms negatively impact the patient's quality life activities and thus contribute enormously towards the depreciation of their quality of life. Conclusion. IBS significantly affects the quality of life due to its psychosocial and other GIT symptoms. I'm done with this abstract.
Starting with, I'm roll number 198, Usama Naeem. I will start the introduction part. So basically introduction, we will start with from what actually IBS is. So IBS is a chronic functional gastrointestinal disorder with altered bowel habits associated with abdominal discomfort without structural and biochemical abnormalities. Most commonly, the symptoms associated are GI related, which involve abdominal pain, bloating, discomfort, diarrhea, and constipation, or both. Diarrhea and constipation, that we will call mixed IBS. So the non-gastrointestinal symptoms include fatigue, insomnia, anxiety, and depression disorders. So the etiology of IBS is not completely understood yet. Still, the following factors have been implicated in the suggested pathogenesis of IBS. That is, that are altered gastrointestinal motility, visceral hypersensitivity, post-infectious reactivity, brain-gut interactions, alterations in fecal microflora, bacterial overgrowth, food sensitivity, carbohydrate malabsorption, and intestinal inflammation. These are some of the suggested pathogenesis that are related to the IBS. So next, I would like to invite Ahmed Abdullah to present the next part.
Assalamu alaikum. My name is Ahmed Abdullah, and I'm roll number 196. I'd like to present the associations of IBS. Before I start, I'd like to share why these associations are important, because we're studying the impact of IBS on quality of life. So different associations affect the quality of life in different ways. IBS constitutes a tremendous global burden on health as its global prevalence is 11.5%, and most people have a relapsing course. Existing epidemiological research concerning IBS has found its prevalence to be 10 to 20% in Asia and 7% in Southeast Asia. Some studies associated this with stress and others with diet. Early studies showed a high prevalence among women. The disease was more common among younger age groups, but studies across Asia showed an equal predisposition for males and females. The disease prevalence is also associated with socioeconomic status. IBS has multifaceted deleterious effects on the affected individual's physical and psychological health and health-related quality of life. Research has shown that IBS may lead to other disorders, for example, osteoporosis, Parkinson's disease, sexual dysfunctions, chronic pelvic pain, and fibromyalgia. All these factors affect the quality of life in different ways. Next, I'd like to hand over to Sabur to, to present the next slide.
My name is Abdul Sabur, roll number 198, and I'm gonna present this slide indicating the purpose of our study. The purpose of this systematic review is to compare and contrast the symptoms and the quality of life experienced by the patients with IBS. There are very limited research about this, so our research, it aims to fill that gap. Literature has shown that IBS affects more than 90% of the adults aged 18 or more, and the predominant symptom in older age group is constipation. So our systematic review aims to compare the existing studies and research articles on IBS and review the effect it has on the diverse population of Southeast Asia. It will correlate the intensity of symptoms that appear according to a scale and attempt to point our similarities and differences that can hopefully give us a better understanding of presentation of IBS in different populations. And our target audience would be adults from 18 to 40. So for next methods and others, I would like to invite Faiza Khan.
So my name is Faiza Khan. I'm roll number 45, and I'll be explaining to you the methods of this research article. And they will be further divided into three categories, you can say 3 parts. And first of all, I'll be telling you how the data sources and search strategies were conducted. So starting with that, first of all. Okay, so the systematic review, of course, was performed in compliance with the PRISMA 2020 guidelines, and PubMed, Google Scholar, and ParkMedinet was searched to retrieve studies published in each database from inception up till 22nd October 2022. No language restrictions were put forth. All articles related to IBS in Southeast Asia were screened without applying any filters. And here we have mentioned a list of the keywords which we used to screen some of the studies, so you can look at them as well. And the studies comprising the general population in which a diagnostic criteria of IBS could be applied were included. The outcome was considered to be the effect of IBS on health-related quality of life in Southeast Asia. Okay, so moving on to the selection of studies. Two reviewers, they performed the database search using combinations of keywords, and they independently screened the titles and abstracts based on the following inclusion criteria, which we are also going to tell you, which will be explained in the table later on. And the reviewers excluded any studies with incomplete data and those without any accessible full-length paper. So coming on to the inclusion criteria, first of all the observational studies, including cohort studies, case control studies, cross-sectional studies, and longitudinal studies involving only human participants with no limit on age, gender, and ethnicity were included. Then studies involving the general population in which either Rome or Manning diagnostic criteria of IBS could be applied were included. And lastly, the studies reporting at least one subjective or objective effect of IBS on quality of life were included. So moving on to how the data was extracted. All the relevant articles were transferred to Zotero and screened in order to remove duplicates. Each reviewer independently assessed full text studies to determine their eligibility for inclusion in the review. And 2 reviewers then independently performed data extraction and synthesis to remove any possible discrepancies. And lastly, a 3rd reviewer cross-checked the entries for accuracy and completeness. So I'll hand over it to the next presenter, please.
Assalamualaikum. Roll number 43, Bisma Tariq. I would be presenting the Prisma flowchart that we used for our systematic review. We followed the Prisma 2020 guidelines and made our Prisma flowchart. Firstly, the records identified were from Google Scholar, PubMed, PassMedinet, and Cochrane. These were the electronic databases that we used. The Prisma flowchart consists of 4 basic steps: identification, screening, eligibility, and inclusion. After the screening, after we use the electronic databases, a total of 20,234 articles were used and by us. The records removed before screening were 19,700. The records that were seen were 5,034. The whole screening process is now started as is shown in the Prisma flowchart. The records excluded were 523. Then the records that were sought for retrieval were 43. Then after that, we recorded our reports that were accessed for eligibility. The reports accessed for eligibility were 43. A total of from 43, a total of 9 were used in our study that we incorporated our study and used for further data extraction. The reports that were included from 43 were on the basis of title and abstract. That included 19 studies, and systematic reviews, and trials were also excluded from our studies. Thank you.
Assalamualaikum, this is Faiza Kambar, roll number 47, and I'll be presenting the characteristics of the studies included in our systematic review. There were a total of 9 studies, and the first study is anxiety and depression in various functional gastrointestinal disorders. Do differences exist? It was conducted in University of Malaya, and it was a cross-sectional study that was conducted among 248 patients, and the primary outcome of the study was anxiety is more common in patients with irritable bowel syndrome than those in the function dyspepsia and NERD. The second study was anxiety and female gender are related to the irritable bowel syndrome in medical students using new Rome 4 criteria. And it is also a cross-sectional study that is conducted in Indonesia among 350 students. And the primary outcome was anxiety and female gender are related to the irritable bowel syndrome. The third study that we included was functional abdominal pain disorders in adolescents in Indonesia and their association with the family-related stress. It is a cross-sectional study of Indonesia that included 1,813 questionnaires, and the primary outcome of the study was that female gender and home stresses predisposed to the functional abdominal pain disorder. The fourth study that we included was irritable in the Indonesian adolescents, and it is a cross-sectional study that included 454 adolescents, and the primary outcome of the study was that the prevalence of irritable bowel syndrome was 30.2. The fifth study that we included was the prevalence and factors associated with the irritable bowel syndrome among medical students in a Malaysian private university. It is a cross-sectional study that included 190 students of the Malaysian University, and the primary outcome of the study was that irritable bowel syndrome is common among Malaysian medical students. The next study that we included was the prevalence and factors associated with the irritable bowel syndrome among medical students in the Malaysian private. It was prevalence of the irritable bowel syndrome in the young adult Malaysians, a survey among the medical students. And it is a cross-sectional study that included 533 questionnaires. And the primary outcome was that the prevalence rate of 15.8 was recorded in the young Malaysians of irritable bowel syndrome. The next study that we included was the Rome 3 survey of irritable bowel syndrome among the ethnic Malays, and it is also a cross-sectional studies among 221 subjects. And the primary outcome was that irritable bowel syndrome was present in 10.9%, and red flags in 22.2%, and psychosocial alarm features in 9% of the subject. The next study we included was that the impact of irritable bowel syndrome on health-related quality of life. That was the Singaporean perspective. It is a cross-sectional study that included 449 questionnaires, and the primary outcome of the study was irritable bowel syndrome has a significant negative impact on the quality of life. The last study that we included was that the prevalence, symptoms, and characteristics and impact of irritable bowel syndrome in an Asian urban community. It is a cross-sectional study that included 2,276 responses. And the primary outcome of the study was that the prevalence of irritable bowel syndrome was 11% and 11% and 10.4%, 8.6% by manning the Rome 1 and Rome 3 criteria. Thank you. Now I hand over the presentation to the next presenter.
Assalamu alaikum. This is Fakhrunisa, roll number 48. I'm going to present the results of our systematic review. We divided our studies into two categories, those using quality of life index scale and those without quality of life index scale. So the studies using QOL scale were 3 out of 9 studies. The first one, irritable bowel syndrome in Indonesian adolescents, showed that the prevalence of IBS was found to be 30.2% among the participants, and with the diarrhea subtype being the most frequent. The female gender and 14 to 16 years of age, bullying, sexual abuse, consuming tea, coffee, soft drinks, and nuts, all of these were found to be the major risk factors for IBS. And it showed a significant interference with the activity, health worry, food avoidance, social reaction, relationships, and body image to be significantly associated with IBS. The next study, the impact of IBS on health-related quality of life, a Singapore perspective, found that younger age, higher education level, and employment status were significantly associated with IBS. And it found the prevalence of IBS was significantly associated with males. The next study, the prevalence, symptom characteristics, and impact of IBS in an Asian urban community, showed that the younger age groups, less than 50 years of age, had more prevalence of IBS as compared to the old age group, greater than 50 years. And it also found that IBS was significantly associated with women according to the Manning criteria. It also showed that IBS patients had significantly lower QOL scale than non-IBS patients, even after adjustment for gender, age, and anxiety using multiple covariance analysis. Now, moving on to the studies without QOL scale. 6 of our remaining studies evaluated the impact of IBS on quality of life without using quality of life index scale. The results of these studies are as follows. The first one, anxiety and depression in various functional GI disorders, do differences exist, showed a significant relationship between IBS and psychosocial illnesses such as anxiety and depression. It used the hospital anxiety and depression scale, and it showed that the mean anxiety score of IBS was found to be higher as compared to the controls and other functional gastrointestinal disorders. And it showed that the prevalence of IBS, the prevalence of anxiety among IBS subjects was 67.7%, while that of depression was 38.7%. Concomitant anxiety and depression was found to be the highest in patients with IBS. The next study, anxiety and female gender, are related to IBS in medical students using new Rome 4 criteria, showed the diarrhea subtype to be the most predominant one. And it also showed that anxiety was found to be related to IBS, and female gender was also found to have significant association with IBS. The 2 inventory scores were used, the student life and stress inventory score, that is the stressor score, and the response to stressor score. This study showed that there was a significant association between IBS and anxiety. The next study, functional abdominal pain disorders in adolescents in Indonesia and their association with family-related stress, showed a higher prevalence among girls and those exposed to family-related stressful events. The study found that belching and vomiting, bloating were some significant intestinal symptoms related to IBS. The next study, prevalence and factors associated with IBS among medical students in a Malaysian private university. It was a cross-sectional study which used the hospital anxiety and depression scale again and the Pittsburgh Sleep Index Quality Scale. It found that 56.3% of the subjects were females, while 14.7% subjects were diagnosed with IBS. It showed a significant association between IBS and depression, and anxiety was also reported in 58.9% students, while 51.6% had diminished quality of sleep. The next study, prevalence of IBS in young adult Malaysians, a survey among medical students, showed again the IBS to be significantly associated with women, and 77.4% were associated with constipation predominant and 7.1% with diarrhea predominant IBS, while 15.5% fell into the non-specific category. The associated symptoms reported in the study were anxiety, depression, insomnia, headache, and backache. These symptoms were significantly associated with IBS. The next study, Rome 3 survey of IBS among ethnic Malays, showed that the most common subtype was IBS mixed type, followed by constipation predominant IBS, and then diarrhea predominant IBS, and then unsubtyped IBS. 30.8% of the female subjects with IBS complained of menstrual pain. These were the results of our systematic review, and they showed a significant association of IBS with anxiety, depression, various psychosocial illnesses, and other gastric symptoms. Now, I would like to call over Faiza Kudsia to present the discussion of our systematic review.
Assalamu alaikum. My roll number is 46. I am Faiza Kudsia. I will be presenting discussion of our study. The results of our study showed significant association between irritable bowel syndrome and the diminished quality of life. 3 of our studies used the quality of life index scale, and 4 of our studies revealed the association between IBS and the psychosocial symptoms, which are ultimately lead to the low quality of life. 2 of our studies showed association of IBS with generalized symptoms of menstrual pain, bloating, and etc. 6 studies found a higher incidence among females, while only 1 study found IBS to be significantly associated with males. According to 3 studies, the younger age group has been revealed to be significantly associated with IBS, while the 6 of our studies were carried out on students. Stress was established as a correlative of IBS in 2 studies. And a study also found IBS to be significantly associated with employed personnel. That completes our discussion, which I'll off to the next presenter.
Now, this is Fakhrunissa, roll number 48. I would like to present the strengths and limitations of our systematic review. Our systematic review is the first of its kind to evaluate the impact of IBS on the health-related quality of life of people in Southeast Asia. We've summarized the impact of IBS on quality of life in various Southeast Asian regions using QOL scale and those without QOL scale. We thoroughly searched various databases, and the included studies employed Rome and Manning criteria for the diagnosis of IBS. The IBS population in various Southeast Asian regions was found and studied, and the people of different ages, gender, and ethnicity were included in those studies. Most of our studies were conducted on students, and there was a very small population where the elderly were included too. Furthermore, the studies include assess the effect of IBS on the quality of life in only some of the Southeast Asian countries, such as Vietnam, Indonesia, Malaysia, while the minor Southeast Asian countries were not studied. And apart from these, certain aspects of the quality of life were not covered in assessing the impact of IBS on quality of life, such as work absenteeism, financial conditions, environment, social responsibilities, and freedom. And the included studies evaluated the impact of IBS on quality of life with and without QOL scale. So we could not perform a meta-regression analysis. Now, the future research implications were that future trials and cross-sectional studies should also explore the impact of IBS on the quality of life of populations of older age groups, as well as underrepresented countries of Southeast Asia. Conducting trials, including people of different age groups and ethnicities, might help in generalizing the findings to various Southeast Asian regions. Further research investigators evaluating the impact of IBS in Southeast Asia should also include other aspects of quality of life apart from the ones already explored. The conclusion of our systematic review is that IBS has significant association with the various psychosocial illnesses and gastrointestinal symptoms. The impact of IBS on quality of life is highly significant, and IBS was found to have significant association with anxiety, depression, psychosocial illnesses, and thus it provides evidence of the disastrous effects of IBS on mental health. Moreover, it was found to be more common among the female gender, students, and unemployed personnel, thus highlighting the strong relationship of IBS with stress. This shows that IBS constitutes a tremendous burden on the healthcare system of Southeast Asia. Thank you.